here today. My name is David Griffith. I'm the Director of Programs and Outreach here for the LGBT Elder Initiative, and would like to welcome you to today's Doctors In program. For those of you who have been to some of the Doctors In programming before, as you know, this is something that we do each month with the Jefferson Department of Family and Community Medicine, working with their geriatricians over there to do a monthly health presentation on topics that are relevant and pertinent to LGBT individuals as they are getting older. Please welcome them.
Hi everyone, it's nice to have some familiar faces and some new faces. I also have Dr. John Lee Antonio, who is here gonna be chiming in at times, and we're gonna talk today about sexuality, sexual health in later life. I kind of wanted to start, can everybody see this? The big theme, well there's a couple of themes, but one is sex never gets old, and I like this representation of that, and kind of wanted to frame today's talk a little bit different. I do have a talk planned so that I can kind of go through some things with you all, but I really thought that this could be a good opportunity for discussion. And so one of the things that I wanted to do is I'm gonna kind of present a discussion theme for you all to be thinking about. We'll go through the talk, and there'll probably be questions and experiences that you all have had that come up as I'm giving the talk. And what I'd really love for us to do is, after I'm done going through some of the slides, we'll break up into maybe 3 or 4 groups. We'll have some time to talk in a smaller setting, and then we'll come back to the group with our own experiences. And the discussion question that I'm presenting, and then also you can come up with some of your own, but is, can you remember a message about aging and sex or sexuality that you heard when you were growing up? So let that sit with you. And here's our outline for today. I'll go through a little bit of an introduction. I'm going to talk about some of the normal physical changes that come with aging that may impact us sexually. I'm going to talk about medical conditions that can cause sexual problems. And I do want to talk some about sexually transmitted infections and condom use, some ideas of what you can do to address these issues, and then we'll have the discussion. So again, here's that discussion question, and we'll go through. So I think one of the things that, going back to sex never gets old, is that people want to be close to people, and that doesn't necessarily change as we get older. And that closeness can be a desire to continue active, satisfying sex life, and there may be changes or adaptations that we need to make to accommodate some of our physical changes that happen. And then there's many different ways to have sex and be intimate, alone or with a partner. And some adults may choose not to engage in sexual activity, and that's also normal. And I think one of the things that I do want to also be bringing to the table here is that all of these things are important. I want you all to be able to feel comfortable going to the person that you see as your doctor, your primary care, and to be able to bring these things up. As physicians, we want to know if you're having any of these things come up for you, and there are ways that we can support you. And I've had patients who come and who kind of have told me different strategies that they're using to adjust. They're adjusting, and so that's kind of the overarching theme. So sexual activity in aging adults. I think one of the biggest myths that I hear is that older adults aren't sexually active. And I thought this was really important to look at. This is a graph. We don't have a lot of numbers and data here today, but this graph, As we age, maybe there is less sexual activity that's going on in the oldest group, 75 to 85. But in this huge group, the 57 to 64, 73% of people reported being sexually active. And so that's one of the biggest myths that I like to chop down. You know, people are sexually active, and that doesn't change necessarily as we age. Some of the normal physical changes with aging. So I think when I talk to my patients, one of the biggest things is vaginal changes. And these are real changes that happen with a vagina as it ages. It can become shortened, narrowed, the walls are thinner and stiffer, and that actually makes it so that the vagina is less lubricated. And these changes can make it so that it can be painful to have sexual intercourse and make it less desirable. We're not going to get into all of the ways to help this, but in each of these topics, I want to just give a little bit that vaginal dryness, if it's an issue, there are things that can be used, and one of those is of water-based lubricating jelly or lubricated condoms, and there are actually things that some physicians might prescribe, so vaginal estrogen, hormonal therapy, and this is something that I really think would be important to talk to your doctor about if you're experiencing. There's things that we can do that can help. And so with aging, there's also erectile dysfunction, or ED, and this occurs more frequently as we age. Technically, it's defined as the loss of ability to have or keep an erection, and it may be that it's taking longer to have an erection and making it so that sex becomes more stressful, more aggravating, more upsetting for everybody involved. Erectile dysfunction that happens every now and then isn't necessarily something that needs medical intervention, but if it's something that's happening pretty frequently, it would be something that can be addressed with a doctor. So again, talk to your doctor. So in the next section, I really want to get into medical conditions that can cause sexual problems. And these are medical conditions, a lot of them actually, as I was going through it, a lot of them are conditions that we've talked about in our other talks, different things like arthritis and things. So I think it's important to recognize that conditions that are more common in older adults can influence persons' different components of sexual health. So arthritis, the first two are arthritis and chronic pain. And I see this a lot with my patients, that their arthritis makes it difficult to find positions that are comfortable while having sex. And you know, we've kind of talked about it, I think in my last lecture that I gave about bone health, is that there are options to help with arthritis, and that's exercise, drugs. Sometimes people need joint replacements. Those are all things that are important to be addressing in your health in order to help to make it so that being physically active and in that respect being able to engage in sexual activity is comfortable. Other things that don't necessarily require a doctor's intervention, like rest, warm baths, different position changes, can also be useful and important. Chronic pain, again, this is somewhat similar to the arthritis, but it can interfere with intimacy in similar ways because of the pain that people face, and limiting in positions. I find that a lot of my patients who have chronic pain, they're scared to put themselves into a position that they would end up worsening their pain. Their pain is such a problem in the day-to-day, and they don't want anything to make that worse. I think it's important, and we've talked about this in our previous lecture, that pain happens, but living with pain isn't always something to be expected as part of normal aging. And that's where it's important to talk to your doctor about pain that you're having, and that there are some interventions that we can do, but also important to know that some medications, and we'll get into this a little bit later, can also interfere with sexual function. Hi, come on in. Dementia, which is something that is common, more common as we age, is something that definitely affects our sexual health. And sometimes we find that people who have dementia are actually more interested in sexual and physical closeness, although they may not be able to use their way of sharing that might not be appropriate in like certain social contexts. And then individuals with severe dementia, along with not recognizing their loved ones, they may end up becoming sexually involved or romantically involved with someone else, and that can be, dementia and having loved ones who have dementia is heartbreaking and so difficult for the support giver, the caregivers, but something that I think the best advice with that is to really be connected. I think it's great to the Alzheimer's Association, connecting with people, resources who are experts in the field to support families with that. Diabetes, again, I think diabetes comes into almost all of our talks, and we know that diabetes is a medical condition that can cause erectile dysfunction in men. There's less that's known about how diabetes affects women, although we do know that individuals who have diabetes are more likely to get yeast infections, and that can be vaginal yeast infections, which can make sexual activity very unpleasant. And I think one of the biggest things for diabetes in terms of intervening is making sure that if you have diabetes, that you're seeing your doctor and getting diabetic control with medications, with diet, and then yeast infections are something that we can treat, the doctors can help with to make it so that that sex can be more comfortable and that we're treating a yeast infection. Heart disease. So I hear about heart disease a lot when it comes to my patients and their sexual health. The actual condition of heart disease can narrow and harden the arteries, and that makes blood flow to our entire body decreased, and that can affect a person's ability to have an orgasm and to have an erection. I think also what I hear the most from my patients is that if they've had a heart attack in the past, they are scared that they're going to have a heart attack again, or they're scared if their partner's had a heart attack that they're going to cause them to have a heart attack, and that can that fear can then affect an ability to have an orgasm, to be aroused, to be in the moment because of that fear. I think that and Dr. Reeves talked about this last time, but it is really important if you have any kind of heart disease or loved ones with heart disease to be seeing your primary doctor and your cardiologist on a regular basis so that we can make sure that your heart disease is optimized. And then if there's any new symptoms that you ever experience, regardless of with physical activity or sexual activity, that you are bringing any of those new symptoms to your doctor. And, I think also the fear that goes along, the other part of that is the fear, and that's kind of more of a emotional and psychological component of sex. And so talking about your fears with your partner, talking about them with people in your support network is important. Incontinence is another issue that we face more as we age, and it's something that when there's extra pressure on the bladder, especially in certain positions, it can make it happen more frequently. It's something that can make causes embarrassment and obviously discomfort, and so avoiding accidents by changing positions or emptying the bladder before engaging in sex, and then really talking to your doctor if you're having any urinary symptoms. And I can't stress this enough. Sometimes we try, especially as geriatricians, to check in with our patients to see if there's any urinary symptoms, and just in general, and I find that it's one that people are reluctant to talk about, and it is something, it is important in your health. It's not just part of natural aging to have urinary problems, and so there are things that we can do to support you in that, and so bringing that up with your doctor is really important. Strokes can affect people in many different ways and can cause sometimes people have weakness in certain sides of their body or other side effects from the stroke, which can make engaging in sexual activity difficult. Also, having some forms of paralysis or not being able to move the bottom half of your body doesn't necessarily mean that somebody isn't going to be able to have an orgasm. So talking, if that's something that a loved one or you have experienced, talking to a doctor about that and seeing what the actual limitations are. And again, this is sort of similar to the chronic pain, but thinking through different positions or different medical devices that could be helpful in being able to engage in sex after a stroke. Depression, another one of the topics that we talk about in our talks here. When we're depressed, we are less likely to engage in the things that bring us pleasure and joy, and sex and intimacy can be part of that. And it can be a symptom of depression. And it can be hard to know if you're depressed. And I think one of Dr. Collins's messages during her talk was to reach out to your doctor if you're concerned that you're less engaged in the activities that bring you pleasure, and that depression is something that can be treated and should be treated. And then surgeries. I think as we get older, we have more surgeries, and I think surgeries can change our give us physical limitations, but there's especially surgeries that affect like the breasts or the genital areas that can make it harder to engage in sexual activity, things like a mastectomy, a hysterectomy, and a prostatectomy. And I think that it is true that some sexual activity may be limited after those surgeries, but most people who have those surgeries are able to then later on engage in sexual activity. And then medications. The lists go on and on about medications that can cause sexual problems. And this is a tough one because I feel like if you look at any side effects from medications, if you read the list, go down long enough in the list, there's going to be side effects, and they may affect, they may cause problems with sexual function. And I think it's so two-sided here. Sometimes it's important to be on these medications, and there's real benefits from it. But to know that there are sexual side effects from some of our, medications that we use frequently, like blood pressure medicines or antidepressants and psychiatric medications, and that if you're having any sexual side effects, if you're having erectile dysfunction, or if you're having trouble, if you're finding that you're having more vaginal dryness, that it would be worthwhile to bring it up with a doctor to see if any of these medications could be contributing to that. Again, it might not be the right decision to completely go off the medicine, and that's why talking to a doctor is important, but there you and the doctor could have a conversation about the pros and cons of being on what the benefits of being on the medicine are for you, and then what the side effects are, and to be able to make a safe and informed decision about that. And then alcohol. I mean, I think that it's important to know that too much alcohol consumption affects our health in many ways and can make any of these medical conditions worse than they already are. We do also know that having too much alcohol can cause erection problems and can delay orgasm. All right. I like this one. Age is not a condom. I don't feel like I need to, I couldn't have a conversation about sexual health without making sure that we're talking about having safe sex. And I really liked this campaign. It's out of New York, but their motto is, when it comes to sex, age is not a condom. And I think that is really important, and that whenever engaging in sex that involves vaginal or anal penetration, that we're using a condom. Everybody who has sex is at risk for sexually transmitted diseases. I've listed them here. I'm not going to go through all of the symptoms involved in all of them, but something that is important. I think it's important to get tested, and that's something that I think we as physicians don't necessarily do a good job in our older adults of making sure that that's just part of our regular blood tests that we get every year. But it's something that you should feel good to ask your doctor to get. And I thought that this picture too is important to know that, one of the wonderful things about treatment for HIV is that we are living longer with HIV. And with that comes that the population in the US who has HIV are older. This one kind of right now, it shows that the number of people living with HIV is 1.25 million. If you take this goes 2011, 2015, and 2020, and these are the adults over the age of 50 in the US who are living with HIV. And the proportion is growing because we're living longer with it. So,
are you saying 70% of the population with HIV is over age 50?
That's what they're saying.
Is there any data on, did they seroconvert when they were young? Or are we still seroconverting?
It's a good question. I don't know the answer to that. Yeah.
That's my question.
Yeah.
Yeah, I don't know if I...
Because we did get sloppy, we get lazy, we're sick of condoms, so it could increase with age.
Absolutely, yeah. I can look and I can go back to where I found this to get some. That's a great question. Yeah. Did you have?
It's somewhere in the high teens, the percentage of new HIV diagnoses. About 17 or 18% are in people over 50. Now that's just when they're diagnosed. You don't necessarily know
when they
seroconverted. But there is still a sizable portion of new diagnoses that are happening among older adults.
Yeah.
Thank you.
Yeah, that's good. And I really like this. This is the healthy aging checklist, and it's breast exam, bone density test, blood pressure tests, and HIV tests. This is all part of healthy aging and the things that we should be doing when we're seeing our primary care doctor on a regular basis. What can you do? And I think part of it is talking to your doctor, feeling empowered that these are things that we can go to our doctors about. Something that we want to be creating today, and that's kind of where we're going to do the breakout session, is talking about it and creating community around these issues. And I think remembering that it is also okay to choose to not engage in sexual activity, and that is normal too. And if we have a partner and these changes are happening to feel comfortable talking to our partners about these changes, and that a lot of the solutions to some of the health issues that affect sexual health have to do with finding new positions, new techniques, new ways to engage in sexual activity with our partners. So having conversations with them about that. And then again, here's the question, and I definitely, you know, any other things that you all have thought about during the talk, I want us to be able to talk about during these this breakout session. But I did think that it would be interesting for us to also talk about these messages about aging and sex and sexuality that we heard growing up. So I know we're going to have a couple volunteers. What do you think? 3?
Maybe 4 groups. We think groups.
Yeah. 4 groups. Well, and there's 4 of us doctors, and we'll kind of chat through this. And then what my hope is that we'll come back to the big group and kind of bring some of the main themes that our smaller groups talked about.
So I just think, you know, instead of coming back and kind of talking about everything that was kind of spoken of already, I think that we had some really, really good conversations, it sounds like, in every group. I think the number one thing I'm getting out of this is talk to your partners, talk to your providers, and keep an open conversation about this stuff. I think that in people over a certain age, I think sexuality is super important. I think we have to keep it going. I think it's exciting, and we're here for further questions if you guys have anything else to ask.
When you say talk to your partner and talk to your doctor, I would like an example, because we had somebody here who said they're not comfortable talking to their doctor, and some people may not be comfortable talking to their partners.
So I think the provider piece I'll answer first. I think if you're not comfortable having conversations of sexual nature, I think you need to find somebody else to see. I think you need a provider who you can talk to about this, because this is a really important part of life. So I think it's definitely important. So I would ask you to find somebody else to kind of see if possible. I think in talking to your partners, I think that one's a little more tricky. I think certain relationships have their own kind of dynamic. I think that part's a little bit trickier. But I think as far as providers go, I think having an open dialogue is essential.
Well, the other part that came up was the fact that the doctors have the time, they have about 10 or 15 minutes
That's
to
true.
go in, by the time they're on the computers there, they're looking, they're doing, you know, and you don't feel comfortable. Right? And I think doctors have to take some responsibility for that.
Absolutely.
Absolutely. One thing that we talked about in our group is that, you know, sometimes when we see our doctors only every couple months, there are a lot of things that we have to cover during the visit. And if a person has high blood pressure and diabetes, like those are things that we as doctors are always gonna need to be addressing. And sometimes it's important, if you're having any of the issues that we brought up today, to make a separate appointment just for that, just like you would for a cold or something that you see a doctor for. And we talked about you don't always need to give if you're not comfortable sharing with the person on the phone. You know, I'm having vaginal dryness. Maybe that doesn't feel, maybe you say, I've got a follow-up issue. And then when you see the doctor, it's just that one thing that you're talking about. And we can, as doctors, can really then ask you all the questions that we need to try and get to the bottom of it. And I am 100% with you is that we do, the way that our system is set up, we have so little time with patients, and that's so unfortunate and not right. But it might mean another visit with the doctor.
One thing with Medicare, that you have that yearly
Annual wellness visit.
Yeah.
and that would be a perfect time because they're allowed a lot more time during that period.
Yeah.
That's a great suggestion.
That's a great suggestion. Did everybody hear that?
No.
That the Medicare annual visit, there's a once a year visit that's just kind of about your overall health. And that could be a really good time to bring up some of these issues.
Does Jefferson let us know to come in, or do we have to call and initiate that wellness visit?
You have to call and initiate that. I know.
I work with Kaiser Permanente in California.
Kaiser's the best.
They would have called me, it would have been one.
I know.
Oh my God. This is kind of hard out here.
These are the things I kind of bang my head against the wall with. I know.
They would have called me and said, Mr. Hart, it's time.
Yeah.
If
It's
you
very
have
billable,
Medicare or
too.
anything, reaching out to your doctor to set up appointments is important. We don't quite have the systems in place
Infrastructure,
necessarily. Yes, sir.
Yeah, I want to go back to erectile dysfunction, because I think it made, a natural thing, kind of its own disease. I mean, from what I understand, a lot, and I think, did you mention how important stress, or not being stressed, I think it's a lot of mental things. If you're stressed out, it's going to lead, and then men go crazy or panic, particularly when they can't get it up. Okay, well, maybe important stress, what I understand another way is, Viagra, I think is, I looked at the side effects of Viagra, and the one that stood out for me, at least, again, people is blurred vision. I love sex, but if I'm going to lose my eyesight, I'll find another way. And I think that get rid of stress, and I think that's eating foods or finding yourself mentally. I think the erectile dysfunction is more of a mental kind of thing. You got to get yourself in the right frame of mind. That it should be an enjoyable thing and not. I just think that stress and finding ways to do it and being in a non-stressful. Someone asked me, elderly people that I met in Brazil avoid stress. So I'm not surprised that they go about looking at sex as a way of life. So the main thing they tell them is avoid that stress. Now you got to find a way to do it, maybe yoga or meditation. But before you get with sex, it should be almost, if you're going to die, either die in your sleep or die having sex.
I think that's a great place to wrap up.
No, I think you're right. And I think it is important to emphasize that with erectile dysfunction, there are medications, there are treatments, and talking to a doctor is important, but there is the other extreme of this in our society where we like to kind of throw a pill at things that maybe could be addressed with other means. And absolutely. All right, I think we should wrap up. And
thank you, Dr.
Thank you all
Cooperman.
so much
Very good.
for your participation. Thank you. Thank you.